Good morning, Fergus Falls and Fargo-Moorhead. Welcome to my channel. I'm Dr. Alla from dralasays.com. You can also visit me on my websites, claritybraincenters.com, and or you can visit my other business called seriouset.com for more information about what I do. Today I'm going to start talking a little bit about concussion. It's going to be my first in a series of many to come. In September, I'll be starting another concussion training program that's going to be super intense. Dr. Carrick of the Carrick Institute will be the one that will be presenting the content. I had completed his initial traumatic brain injury course several years ago, and it's just changed my life. And I have since then implemented concussion care in my office, and more to come. It's going to be contemporary. It's going to be fantastic. So let's talk today about concussions and what they are. Concussions are many different things in many people's eyes because the world grabs onto a term and then they redefine it multiple times. But the one thing that people need to understand is a concussion can occur when the head is quickly whipped without impact to any specific entity, whether it's a football helmet, a hockey helmet, a ball to the head playing soccer or volleyball, an elbow to the head playing basketball, a wrestling move where the head is wrenched, a figure skating fall and a whip of the neck, a tennis whip when you're trying to backhand. Any type of quick jar to the neck can create stress on the brain. The brain is this malleable, pliable tissue. It literally is like jello when you take and touch a fresh brain. So we know that if the neck is quickly whipped, that there's inertia, there's a force that happens to the head as well, and on the inside that brain can shift and move. Now, many people can have a whip injury and it results in nothing for them notable with respect to symptoms of what a concussion looks like. But for others, it's a different story. The one thing that people tend to recognize when there is a concussion in the brain related to a whip trauma is that they start to become a little bit withdrawn. Their world doesn't look the same to them as it once did. They may complain of things that might look like fog. They may complain of visual changes. They may complain of focusing issues, and certainly right there and then they're thinking, I need an eye exam. And that's certainly something that may be needed, but the likelihood is it may be related to the whip injury taken, resulting in a shift in the axis of the brain, and now a cascade of chemical events that occur in the brain. So it is imperative to understand that after a whip type of trauma, if you will, if there's fog, it's time for you to step away from that exercise, step away from that sport, and you need to wait. There is a 2-week window post that type of trauma where you need to recognize if it's going away. The majority of symptoms that people experience after a whip trauma that may look like a concussion go away, but there are many that don't. So I want you to pay attention. If you've had any past incident in which you've whipped your neck, or a recent incident and you're just feeling that fogginess about you, do something about it by number 1, stepping away. Wait for more content this week. I hope you're having a great day. You can visit me at dralasays.com, claritybraincenters.com, or seriouset.com. Those are the places where I spend my days trying to serve others in their journey to recovery. Have a wonderful day.